3, 2. Good evening, everybody. Welcome back to the Semantics podcast. Today you've just got me, Reese. Darby and Jelly are not here today for whichever reason. But my guest today is Andre Kleinbaum. Now, he is a practicing osteopath out of Brunswick Heads, and a clinical supervisor here at SCU, as well as a professional experience lecturer. I had the privilege of having Andre as my lecturer for my Pathophysiology 2 unit, and throughout that I found his ability to conceptualize and really make sense of the things that he was teaching cemented everything else that I'd learnt throughout my previous year at uni in terms of physiology and anatomy and things like that. So it's really good to have him here as a guest. I've been looking forward to this podcast for a while, and we're going to be talking about treatment and, you know, what osteopathic treatment is, how he approaches treatment, how he got interested in osteo, and really anything else that comes along the way. So Andre, welcome.
Thanks, Reese. Great to be here. I've also been looking forward to the podcast, considering the good conversations we've had in the past.
Yeah, we had one, I think it was, no one turned up to the lecture in the afternoon one day, and we spoke for about a good 45 minutes, and at the end of it we're like, damn, we should have recorded this. This is such good stuff. So yeah, today we can.
Indeed, that's right. That's why we're here.
Mate, osteopathic treatment. What to you, what is osteopathic treatment? The term holism is always thrown around, but, you know, holism I think is starting to incorporate into other manual practitioners as well. So do you think that kind of decreases or affects the osteopathic treatment philosophy?
You mean that holism is being incorporated into other manual therapies?
Yeah, to me it seems to be synonymous. Holism, that term, has been synonymous with osteopathy, whereas now chiropractic, physiotherapy, remedial massage, you know, they're all incorporating that into their own bios. What are your thoughts about osteopathic treatment and I guess the somewhat blanket term that's been incorporated with every other kind of practitioner out there?
Well, I think the first thing I'd say is that holism, I mean, I think a lot of professionals and professions out there would say that they have been coming from a holistic place for a very long time, and you know, in mind is chiropractics, that they have had a holistic focus, and it's difficult because to be entirely holistic in your approach, you have to take into account probably more than you really ultimately do whenever you're dealing with someone. I think the main thing I wanted to say though about osteopathic treatment is it's not quite as important what you do, but why you're doing it.
So intention.
Well, not just the intention, but, you know, there's lots of different treatments. You know, you could say there's, you know, you can manipulate, you can do a high velocity, low amplitude thrust, so an HVLA.
Yep.
You know, you can work with soft tissues. You can then go into using different approaches such as, you know, balanced ligamentous tension or positional release or strain counter strain. But these techniques, you know, they are not osteopathy. What is osteopathic is the reasons for why you apply them to a particular person when they come in and see you. And the reasons why you apply them is based on careful discussion with them in terms of case history, finding out their story, which is always really interesting in their own personal story.
Yep.
And also the models you use when you're considering what they've come in with.
Right.
So osteopathy has a number of different models that we use. You know, we use these structural models, or we use a fluidic model about how fluid is distributed through the system and then returned back to the heart to be redistributed around.
Yep.
And so based on the model that you apply, the lens you look at the person with and that problem with, that dictates where you're going to apply your treatment.
Right.
Yeah.
In our previous conversation, we were discussing this as well. And you come up with the fantastic analogy of all the practitioners seem to be the same. You know, we're all there to help the person.
Yeah.
It's just a matter of the lens that we look at and diagnose and then eventually treat is slightly varying.
That's right. And that comes out of the philosophy of health that we might have.
Mm-hmm.
So, very good book I read recently about osteopathy by John Lewis, From the Dry Bone to a Living Man, which is a biography of A.T. Still, the founder of osteopathy.
Okay.
It's here in the library. It's a really, really good read. It's a historical read in a sense in terms of figuring out what happened to create a situation in which someone like osteopathy would come along and create something like this. But one of the things he makes quite clear is that the fundamental philosophy of health, of osteopathy, is quite different to the fundamental philosophy of allopathy, which is the mainstream medical approach.
Right.
Now, that's not to say that there isn't a place for either of them and that one is absolutely right, because in the scheme of things, model is not reality, and so you can never say that a model is absolutely right.
Sure.
So, but what that does mean is that based on the fundamental premise of osteopathy, which is that the body contains everything it needs to heal itself, it's a very different approach to treatment than we need to change the body's physiology to heal itself, which is more of an allopathic approach.
Yeah. So, in terms of osteopathy versus physiotherapy versus chiropractic, I was reading a very concise and fantastic article that basically surmised all three of them up.
Oh, yeah. Great.
It was a link on the osteopathy, I believe it was the Osteopathy Australia webpage. And the individual was an osteopath himself, and he pretty much said that osteopathy covers a lot of soft tissue, but incorporates chiropractic and physiotherapy in their thing. Chiropractic focuses on the spine, and physiotherapy focuses on giving exercise prescription as part of their treatment. Now, when I was reading this, it got me thinking, will there eventually be a day where there's going to be no osteopathy, there's going to be no chiropractic, it's just going to be you're a manual practitioner, somewhat of a super practitioner that incorporates the best of each discipline? To me, that seems to be where it's going, you know, like my point about the other practitioners incorporating holism and those type of terminologies in their bio. Will there be a distinct difference between all of us?
Yeah, you've mentioned that before, I think, in our chats, and I mean, first thing I'd say is those are, in some ways, very general descriptions of those professions.
Yeah.
And they also maybe only focus on the majority of what each profession does, or and also where it is currently. I mean, my understanding of chiropractic and physio is limited because I'm an osteopath.
Sure.
And, you know, it's the question you get often from patients of what's the difference between one or the other.
Yeah.
And my understanding of chiropractics, and this is not entirely correct as a generalization, is that their focus is on the spine because their focus is on the nervous system as the dominant system in the body.
Right.
And to influence the function of the nervous system, you can influence it where it then comes out of the nervous system into the body, out of the spinal cord.
Sure.
And then out of the spine itself. And so if there's alterations to the bones of the spine, then that might affect the outflow of those nerves and then affect the health of the tissues that are innervated by those nerves.
Yep.
Now that is not, from what I understand of my readings in osteopathy, is very similar to what A.T. Still was originally saying as well.
Yeah, with his principles and things.
And that alterations of the position of bones within the body will affect nerve flow and blood flow.
Mm-hmm.
Now, you can apply that principle to any part of the body, not just the spine.
Absolutely.
I have an issue with that model of the nervous system being the fundamental system in the body. and not every chiropractor I've met has just treated along those lines.
Yep.
And then physio as well. I mean, physio, our interactions with them in terms of private practitioners is dealing with the same stuff we do, but actually there's a whole bunch of there's a lot of physios in the hospital system that work on very different problems.
Mm-hmm.
They'll see people post-surgical and keep them alive, basically.
Okay.
They'll make sure that they actually are able to continue breathing and do their exercises and do the things that they need to do in hospital to keep them going and repair themselves after they've gone through a major procedure or had a major accident.
Right. I didn't know that.
Yeah, sure. So then the private practitioner, the musculoskeletal physio, is just a portion of the entire umbrella of physio.
Right. So, yeah, physiotherapy is the headline.
Yeah.
And then you've got subcategories underneath that.
Exactly. Yeah.
Now, which would essentially be you can specialize within each.
Yeah.
Within osteo, there doesn't seem to be many specialties. You've got your pediatrics.
Well,
or would it be more?
I'll just stop you first and say that you can't legally say that you specialize in a field. You can say you have an interest in it, but you cannot say I'm a specialist pediatric osteopath. At least not in Australia.
Okay.
Yeah. And that is for the very simple reason that as of now, and maybe this will change in the future, there isn't actually a specialized category of registration for that.
Wow. Is that just osteo?
I'm not sure for other professions, but in osteo, that's definitely the case. And it is definitely being worked upon in terms of a national level.
Okay.
And international as well in terms of where osteo is practiced in the same way.
Right.
That there are movements in the profession towards, should we make, for example, someone who has an interest in pediatrics, should we make a pediatric practice a specialized area of practice? And if so, do we require them to have these extra degrees and requirements in order to do that?
Yep.
So that's a debate that's going on at the moment.
Yeah. I've always been a fan of incorporating pharmaceuticals.
Yeah.
I like the idea that we can, hopefully one day we can prescribe medications now, which I guess is the American version of things. Now I'm not very educated on it, like I'm purely anecdotal, but from what I understand, to be an American osteopath, you do your medical degree and then go into osteopathy.
Well, no, what it is you do a doctor of osteopathic, DO, they become DOs, doctors of osteopathy.
Yep.
And they don't do a medical degree, they do an osteopathy degree.
Oh.
Yeah. And so they come out the other end having gone through an osteopathic school.
Yep.
But they learn in a very similar way everything that you might learn in an MD school, a medical doctor school. But there's also the osteopathic principles that are involved as well.
Oh, okay.
This is where this book would be a really, really good one to look into, because it describes quite nicely how the osteopathy came to be created by A.T. Still, and then also how the first school was set up, and then how subsequent schools were set up, and how that idea came in, and how he was vehemently opposed to the use of medications, partly because at the time medications had been used for a long time and never substantiated.
It was calomel, I believe it was.
Yeah,
and mercury.
Yeah, and arsenic and those kind of things.
Yeah.
And, but his reasoning was the body contains everything it needs to heal itself and to deal with whatever it needs to deal with, including infections.
Yep.
And if you can ensure that a region has everything it needs, including nerve supply and blood supply, then there is, in most cases, no need to intervene with an outside substance, which you cannot control and you cannot target. Now, currently, with nanotech and specific targeting, research, we're trying to figure out how we can target to very specific cells and tissues and structures.
Mm-hmm.
But, that's very new technology that's still on the go, and there's always going to be side effects, which are really just effects you don't want to have. I mean, that was his reasoning. And that, so.
Now, that's all well and good.
Mm-hmm.
But one thing that, because I've read two of Still's books, and they've been his autobiography and how osteopathy became, and
Yeah.
absolutely fascinating. But it was brought about because he was unhappy with the medical practice in the 1800s.
Yeah.
When, as we just mentioned, they were treating with arsenic, mercury, calomel. They were bleeding patients out and then pumping him full of that and then sending him on their way.
Yeah.
So it was very, very crude and just try this and hopefully it works.
Yep.
Well, that medicine is no longer around to that extent.
Yeah.
It's evolved and there's a lot more science behind it now. Do you think that osteopathy still has the same place within medicine as it did back then?
That's a really good question, and I mean, I realize that I might be sounding like a bit of a traditionalist or anything like that, and as much as I really admire what he came up with, I'm not against change. If we find out that some of the stuff he was going on about was not correct, well, then we need to change that.
Yeah, absolutely.
I definitely think we shouldn't leave any belief unexamined or any model unchecked. But I still do think, though, that what he said in terms of the body having its own ability to heal itself, and healing or medicine. See, this is difficult. This is another thing that comes in as well, because he was opposed to the term medicine itself,
right?
Because he believed that signified all that kind of old school approach to the art of healing, or whatever you want to call it,
with the mercury and arsenic and all those things.
So that's why he came up with a completely new term, and then it kind of took on osteopathic medicine, which again he was opposed to, because he felt that you couldn't have the two together. It was an oxymoron,
right?
To have osteopathy and medicine put next to one another, and yet in a sense that's kind of what we're discussing here. That osteopathy could potentially be used to treat not just musculoskeletal complaints, but also other kinds of complaints as well. And I definitely think there's potential for that. I would love to see osteopathy integrated far more within healthcare throughout the world.
Absolutely.
There's so many reasons for it to be integrated. And I understand, that there is an issue with our evidence base, and we're working on that. But I fundamentally look at osteopathy and think, well, it's a science and to some extent an art, but all healing and medicine is as well.
Yep.
And it's based on a knowledge of anatomy and physiology in terms of fundamental, and an appreciation of a person as a complete person, which is where the holistic element comes in.
So, to me, I'm completely on that page. That's why I'd like to see pharmaceuticals and other things like that being incorporated into the teachings of osteopathy, because it seems that if that doesn't happen, then we might be left in the background again. There seems to be there's a resurgence, it seems, of osteopathy coming back, and we're at such a fragile yet endless possibility time right now, where we really need to capitalize and incorporate and move forward and somewhat not be stubborn.
Yeah, I understand what you're saying. I mean, we do need to roll with what's coming and kind of move on into the future. But at the same time, I think you could argue that to include pharmacology as well would be to kind of get rid of what osteopathy does to treat as well. Yeah,
it does go against the principles.
It's not that it's anti-osteopathy for someone to take an anti-inflammatory, although some osteopaths would definitely argue that.
Yeah.
Definitely.
Yeah.
I don't think, but it's just that there's only so much that one practitioner can do.
Yeah.
And if you're using this model of osteopathy, this approach in terms of healthcare, it's not about being averse to using pharmacology. It's about saying, okay, well, at this stage, this is what I can do. It's very possible that you could benefit from some pharmacological intervention.
Yep.
Go see your pharmacist, go see your doctor.
Yep.
For that. And that's a debate that's still going on in the profession, because a lot of people are along the same lines that you're on.
Yep.
And then, people who are on the lines that I am. And then there's people who don't want any pharmacology at all.
They want to keep it completely natural and from the original source almost.
Yeah, and I can understand their reasoning, because if the body has everything it needs to heal itself, then all you need to do is allow an area to, or take away any restrictions. And this is where we get into the treatment.
Yeah.
So the treatment is based on restoring normal function and blood flow and nerve flow and movement.
Yeah.
And then allowing the body to repair itself.
Yeah.
On a micrological, that's not a word. Microscopic level.
Yeah.
Yeah.
Yeah. So treatment, that's now been brought up.
Yeah. Which is what we were talking about in the first place.
Yeah. We've gone, 20 minutes? I kind of mentioned it twice, but hey, that's the fun of it, right?
Yeah.
Now, a question that I'm interested in is when you're treating someone and they come in with whatever presenting complaint that may be, let's say musculoskeletal.
Yep.
Tell us, your focus and do you focus more on their background? Do you focus more on the presenting complaint? How do you approach the diagnosis?
That's a good question. I think I would say that case by case basis, you might find that there are different key bits of the case history or the presenting complaint or your examination that will then dictate what you think is going on and how you treat.
Yep.
And it's never the same as to what exactly it's going to be, and you don't always know what it's going to be. So that's why it's really important to be paying attention. It might be the way someone says something,
like a certain affliction.
Yeah, or I recall treating a lady who came in and she'd had repeated paresthesia, pins and needles in her forearm and arm. And what she said was, it's making me really agitated. And she was really agitated.
Okay.
In fact, it was happening in both arms, I think. And, then you start talking more about, all right, well, tell me about your life. What's going on? Oh, I'm really stressed. She had a really stressful job working for the NHS when I was in the UK. And she was laying people off because that's what's going on over there for the NHS, was a whole other story altogether. But
was this a desk job, I assume?
Yeah, it was a desk job as well, yeah. So then it just occurred to me, well, how many cups of coffee are you drinking to get through all this? And she said, about 12 a day.
Wow.
Yeah.
12 coffees.
Yeah. So the most important thing I did for her, or that that came out of that, was basically to tell her that she needed to cut down her coffee. Because I barely did anything in terms of treatment, really. I did a little bit of treatment and a bit of indirect treatment, which we can talk about as well.
Please.
But the most important thing was I said to her, that is just way too much coffee. You got to cut that down.
Yeah.
And she came back a week later and it had just improved dramatically and she'd cut out a lot of her coffee. But not everyone would have done that.
Yep.
You see, because she was using that to cope.
Yeah. So they'd say that as a coping mechanism, something positive.
Yeah.
Sure.
Yeah, that's right. But it got to the stage where for her, not having the pins and needles was more important than having the coffee to cope. So that's what she decided to try, and it worked. So, but because of how she said it to me, that's kind of dictated where I went from there.
Sure. I've got a few friends that have had osteopathic treatments, but they'll predominantly go to a chiro or a physio.
Yeah.
And one thing that is constantly brought, well, not constantly, but seems to be a recurring complaint, I guess, is I go see an osteo and all they do is touch this one bit of my my shoulder and stay there for the full 20 minutes. For people that are trained in osteopathy or learning it, we can understand that. Yeah. But for the general public, they're going in and having a hand laid on them. Yeah. It seems like they want that immediate, somewhat aggressive type treatment. Now, how do you deal with that yourself? Have you had anyone that has come back or mentioned to you that, I was treated by this osteopath and all they did was put a bit of traction in my occiput,
Yeah, the two things that come to mind in regards to that, I'm not sure if I can think of a specific case, although that might come, is basically communication with your patient. That's what's missing there. Yep. In terms of I'm going to do this.
Yeah.
And my reasoning for that is that these things are going to happen.
Right.
And by doing this, I am looking to address what you've come in with.
Yeah.
And this is my reasoning for why this could affect that.
Right.
This is how long it's going to take.
Mm-hmm.
You may not feel anything straight away. That's pretty normal. If you don't feel anything within a certain amount of time, then
yeah.
So that's the communication and the negotiation with your patient as to how you're treating them.
Yeah.
And the second thing to that is, and this is where we get into placebo and how what people expect as well.
Yeah.
So a lot of people who've had that kind of manipulative approach or soft tissue approach, they kind of come to expect that. And manipulation, I mean, I find it very useful. I do use it.
Yep.
I don't use it excessively. There might be sometimes days or a week or two that goes by and I haven't done
in terms of
more than one or two.
HVLA.
Yeah.
Right.
Or I might do a whole bunch of them in a day. It just varies.
Yep.
But for, because people feel like something's happening, they often feel, well, I could feel that, I could hear it, something has changed.
Yeah, there's no reason why nothing has happened.
That's right.
Yeah.
But we know from research, and this is something that we have been researching, is that the changes from manipulation seem to be very short-lasting. Now, I think that it's possible sometimes to get a long-term change with manipulation, but that's my thoughts.
Yeah.
And difficult. I'm not sure if there is research out there for that, which maybe there is. But some people, that's what they want. They want to come in and feel that click.
Yeah.
And in a sense, what you're doing is you're building up tension in a region, which you can feel.
Yeah.
And then very quickly, you're releasing it.
Yeah.
It's going to feel great.
Yeah.
It's going to happen.
But one would then protest and say that clicking is actually destroying, well, not destroying, but negating the structural integrity of that specific joint, because the clicking is, from what I've been told and taught, is actually the recoil of the tendon or the ligament, which then alters the integrity of that particular tissue and then increases the potential damage and injury of that joint even more. So could it be like an immediate versus long-term thing? Because HVLA is, from just what I can perceive, is very popular.
Very popular.
But is it actually as effective as the popularity might suggest?
I would say yes, it is very popular, and I would say no, it's not as effective as the popularity would suggest.
Right.
Yeah. But I would also go on to say that it's not entirely clear whether it is entirely destructive.
Yeah.
And a manipulation done well, it can be done well within physiological limits, and that means not going beyond what a ligament or a joint is normally going beyond. So if you are trained appropriately, to do these techniques, then you won't be going beyond what the joint normally does in someone's own normal range of motion. You're just building up based on a physiological law, which is that every time you introduce a movement into a joint, you reduce the amounts of movement in other planes. Yeah.
Which would, I guess, where BLT comes really neatly into it.
Yeah.
Can you explain what BLT is?
To some extent, I suppose I can, but it's basically, this is where we come into indirect versus direct approaches of treatment.
Right.
So direct treatment is basically, and this is in an osteopathic context, this is the way we discuss it, which is another thing in terms of the difference between professions, is we have different languages and different terms. So direct for osteopathy is, say, okay, C2 doesn't move left on C3. Direct, if you're going to take a direct approach, you're going to move C2 left on C3.
You're going to go towards the barrier.
Exactly.
Yep.
Yeah. Indirect is, okay, C2 doesn't move to left on C3. Okay, well, I'm going to take it away from the barrier. Yeah. And then using a chain of effects such as a change in proprioception and probably other physiological mechanisms in there that
the neuromuscular pathway of resetting the particular muscle around that.
Then
joint.
You're going to find a way where it will correct itself in a sense.
Yeah.
And that's when, to some extent, you start working more. You start working. The reason I think an indirect approach works, and that's something I tell my patients, is because you're dealing with a living organism. You're dealing with a living system that responds from depending on the input you put into it.
Yep.
If you were to take a chair that was leaning over to the left and try and bring it right, right by taking it further left, you're going to just tip it over.
Yeah.
Because there's no self-corrective mechanisms involved in an inanimate object like a chair.
Yeah.
Yeah. But a human body has loads of self-corrective
Yep.
homeostatic mechanisms within it.
Yeah.
And one of the basic tenets of osteopathy is that, the body will tend towards health.
Yep.
It will always try and express health.
Yep.
But there can be barriers to that occurring based on anything from genetics to trauma to chemical interventions, poisons,
social, emotional,
like social emotional habits such as being closed off and closing yourself down and then shutting down your chest.
Yeah.
If you're slumped over, and then, how does that affect your breathing, which then how does that affect your circulation? And then if you're not circulating properly, you don't feel that great either. So,
and to me, that is the magic of, any manual practitioner.
Yeah.
Particularly osteopathy, because that's what I'm learning.
Yeah.
The fact that the way that you carry yourself can dictate or is dictated by your emotions and vice versa.
Yeah.
And it's that unraveling. I often, when I look at someone that's carrying some kind of injury, I often think of a piece of rope in my mind, or when you pull the hose out, and you're about to clean your car and it's all tangled up, and you go, okay, which end do I start with?
Yeah.
You can either start with the feet, or you can either start with the head.
Yeah.
But ultimately, I want to get this piece of rope or hose straightened out so the water can flow smoothly.
Yeah.
To me, that is my approach to seeing dysfunction in people.
Yeah.
When you look at a patient coming in, do you, how do you, I want to know mentally how you visualize things and how you approach your treatment.
Yeah, so the overall thing that I do is you start very broad, and then you narrow down.
Sure.
And your narrowing down is based on your case history.
Yep.
And it's based on your examination, basically.
Your 13-step screening?
Well, I don't use 13 steps myself.
Okay.
But I use another protocol that is based off what an osteopath in the UK initially set up in terms of looking at the body in terms of 3 different unities, including the neck and upper extremity, the pelvis and the lower extremity, and then the thorax and the to some extent the lumbar spine as well. So you're looking at these 3 different unities, and then with your case history, you're trying to figure out, for one, what is the source of this person's complaint.
Yep.
And for another, you're trying to figure out why is that the case.
Yep.
Do they have low back pain because they were punched in the jaw and it's shifted their jaw or compressed their jaw, and then that changes their entire posture to walk around
because they've got to carry that injury.
Yeah, that it strains their low back,
Yeah.
Or, do they have low back pain because they fell over snowboarding and landed on ice, basically?
A direct trauma.
Yeah.
Yeah.
Or do they have low back pain because they've just broken up with their partner, or they're carrying all this stress, for example.
As I mentioned earlier, I've essentially abandoned my bed. It's too soft for me.
He did.
And, my training has been the same. Nothing's really changed. And it's been 2 days since I've been sleeping on this tiny little thin futon, I suppose.
Yeah.
And that increased resistance, my back feels 1,000 times better.
Yeah.
Which brings up something that I was pondering because of this. From my experience, there doesn't seem to be much emphasis and stress placed on treatment in terms of what you sleep on, in terms of how you rest for up to, if you're lucky, 8 hours a night. You'll get a treatment at an osteopath or any kind of manual practitioner, and it might be an hour. Not even that, because the hour is you've got the assessment, so maybe 45 minutes, depends how quick the assessment goes, which is all well and good, but then you're going home and sleeping in a crappy bed that's just exacerbating whatever injury you've got. To you, what are some areas in osteopathy that, well, manual practitioner, that you think should be more emphasized and stressed?
That's a really good point. I think, depending on the case, sometimes I think we don't have enough maybe management of our patients when they're not with us.
Management, yes.
Yeah, and definitely habits that you do on a daily basis.
Yeah.
And you're absolutely right. I mean, if someone's seeing you for half an hour a week, and then they go and and they sit down for 12 hours a day.
Yeah.
Then you're trying to counteract 12 hours of sitting versus maybe 25 minutes of moving their body.
Yep.
But I'll point out another thing in there as well, is that treatment is, the length of time is not important necessarily.
Right.
So if you consider someone going in for surgery, it's not the length of time that they're having surgery, and you wouldn't really want someone to be being cut up for, if they were scheduled for surgery to remove something, you wouldn't want them to be under there any more than necessary, right?
Yeah.
So if you apply that same thought to our treatment, it changes things a bit, because no longer is there the thought of, I'm going to treat you as much as I can.
Yeah.
I'm going to treat you for an hour like I would be doing a massage on you.
Yeah.
There's a thought of, well, let me do as little as possible, because every bit more I do is actually harmful.
Yeah, that there comes to a point of diminishing returns of,
Yeah, and potentially harm.
Yeah.
So it's no longer just, you're not going to get more change. You're also just going to start getting more of a reaction, and more of it, more than you need.
Yep. The intention that you bring, as a practitioner in your treatment, to me, intention is one of my favorite words now. I think a lot of things can be negated with the intention you have.
Yeah.
Your intention in treating, clearly it's to get the person better, but and to help that person. But I suppose this reintroduces placebo. If the patient's coming into you with no expectation of anything, versus someone with, I'm going to be cured this instant after this treatment, how much importance do you think intention of the patient versus intention of the practitioner there is?
Oh, it's huge. Absolutely. Yep. I think intention is massive, and it comes back to what we were saying before about manipulation.
Yeah.
This is something that my partner, who's a physio, has been adamant about the whole time, that it doesn't really matter who someone goes to see, as long as they believe that person can help them.
Yep.
And if they say, well, I do better with physio, then they'll do better with physio.
Yeah.
Even
though the physio might be doing very basic, somewhat osteopathic treatments, it's still, physio's the way to go. I trust them. I believe in them.
Yeah.
They're going to give me what I need.
Yeah. And placebo is hugely important, and we don't give it enough credit, I think. Sometimes we have these very complex theories as to why something we're doing is working, and really it's just placebo.
Absolutely.
But even that, when I say it's just placebo, that's huge. I mean, if you're dealing with someone's problem from 10, 15 years, and placebo makes that change, then amazing. Bring it on.
There was a video that I was watching. It was just a YouTube clip. And I'm going to post this video on our site so that others can watch it as well. It was essentially a surgeon in America, and he had three elderly males all needing knee replacements.
Yeah.
Now, he in essence he negated his practitioner, because he gave the complete surgery to one male. Did the reconstruction, did everything. To the second one, I believed he just cleaned up the cartilage in the knee. And the third individual, under anesthetic, all the protocols were obeyed. All he did was make 2 cuts either side of the patella tendon, sewn him back up, and then set him on his way. And then they caught up with the patient with the placebo, because that was of interest. And prior to surgery, he was with a walking stick. He hobbled around. He was relatively immobile. And post placebo surgery, he was playing basketball, jumping around with his grandchildren. And they didn't
cured.
Yeah, all cured. And this was, I think, 2 years afterwards, and they said to him, mate, we did nothing. Here's the scans. Your knee's the exact same. And it was just, placebo. Look, if it's a sugar pill and it's doing something positive, keep giving him a sugar pill.
For sure.
Who cares? The only thing I want to know is if they charged him for the surgery. I think the morals and ethics might get highlighted there.
They mustn't have charged them.
No, surely not. But it was absolutely fascinating.
It's a good study, that one.
Yeah.
Oh, it is. And you got to use that, I think, as a practitioner. You got to use that as well. And I think that's sometimes why very personable people will get very good results, in a sense. To some extent. I mean, I think there is also something to be said about the skill of the actual what you do as well. And not just how you interact with your patients. There is definitely something to that too. But intention, I think that's what your initial kind of question was about, in terms of patient intention and practitioner intention. I think in terms of indirect techniques, we take it back there. Intention is the key thing, really. And I again recall coming across a study of I think it was a neurology study where they took a group of people, pianists, and they split them in half. And one set, they said, all right, we want you to practice this song, so many times a week on a piano. And we'll assess how well you do after that amount of time. And the other group, we said, we want you to practice this song in your head.
Okay.
Without at a piano. And then at the end of that time, we want to see how well you actually play it as well. And there was very little difference between the two groups at the end of this time.
Very little difference.
There
you go.
And to take it a step further, if you imagine that you're in your mind that you're contracting muscles and you're not physically doing it, you will actually find, if you measure the electrical activity of that muscle, that it does actually stimulate.
Similar concept to one arm being broken and immobilized. If you train the other arm, there's a direct reflection onto the immobilized arm, to the point that muscle atrophy won't occur at such a rapid rate, as opposed to someone not.
Interesting.
I can't name the thing off the top of my head, but I've heard of that many times, and the simple act of just visualizing. I love combat sports, and I'm always into like the mentality of someone that's about to get into a fight in a cage or a ring, and it's that visualization, that can really be the breaking point. And I think this brings it in, that intention, and there's nothing magical about anything we do. It's not a magical profession. We don't we're not using anything that isn't there. It's all based on what is there and the physicality of it. So if you're doing an indirect technique where you're being quite gentle with the structure, and you're taking it into a direction of ease, and you're visualizing a change, and you're trying to intend for that to occur. I think that what is actually happening is that there is in some ways you could say there's a communication between your hands and your intention and the person's body, and that there's a response from that body with the self-corrective mechanisms that then allows a change to occur, and the body will then, in a sense, use your pressure and force, your external pressure and force, as a fulcrum, a point around which you can do work to create a change in that area, in that region, and then that makes the correction. Now, to play devil's advocate, I'm just a regular guy off the street. I'm a brickies labourer. All that kind of airy fairy stuff doesn't work. To me, I guess I'm essentially similar to that. I like to know things. I don't like to leave things up to speculation, which is why I like science. And osteopathy is very science heavy. But to me, the intention of the practitioner is all well and good. And what you intend on doing and how the patient's body reacts is fine. But things like Reiki and other forms of treating treatment, I suppose. You know, that
Yeah.
to me, that falls in a similar category.
Yeah.
And which is, I suppose, where we don't want to be.
Yeah.
Because we don't want to be synonymous or compared to things of that nature, because at the end of the day, personally, I don't think that works at all.
Yeah.
But more spiritual beings, more mindful beings, they might swear by it.
Yeah.
But the vast majority of us, we're not like that.
Yeah. Well, that's where I would say something like Reiki, maybe it does have an effect, but not for the reasons that are given for it.
Right.
You know, maybe it's not a matter of energy transfer that's coming through you from the universe, as they say.
Yep.
Maybe there's an effect of a person becoming aware of those regions.
Mm-hmm.
The heat from your hands, even though you're not touching, the heat creates a metabolic change in that region,
Yeah.
and then that increases blood flow.
That,
You
because
know?
it's backed by physiology,
Yeah.
I'm with.
Yeah. But yet again, you see, that comes back to in a sense, a Western medical or Western science model of the body.
Yeah.
Which we must remember again, you know, models are not reality.
Models are not reality.
Yeah. And it's as you know, as soon as that clicks, you're just like, okay, well then, if a patient comes in to see me and my models don't work, well then that's fine. I don't have to feel offended. I don't have to feel like my approach is useless.
Yep.
But I can go, okay, well I'll put that aside and maybe we'll try this model, or maybe I'll send you to that person who has this model who explains it.
Yeah.
And you know, maybe we'll find that for some of these approaches, they can be explained using investigations and models that we don't know of yet,
Mm-hmm.
such as, you know, before we knew about radiation.
Yep. Yeah.
Who would have thought that it was possible to have this thing called radiation?
Yeah. Yeah.
And I think that's where there's a difference between being completely closed-minded
Mm-hmm.
and just blindly buying into something without actual consideration as well. Because there's stuff that happens, and I'm sure that people have experienced, that is very difficult to explain.
Yeah. that blindly buying into things, you know, you see that a lot on rubbish television. You know, oh, buy this latest, you know, we've got a new diet coming up, or we've got this, what was it? I was watching telly, which I rarely do. And it was essentially just a rehash of like a vibrating platform that you saw in, you know, gyms back in the 80s or the 70s, where you'd stand on it and it would vibrate, and just that movement, you know, caused you to lose all this weight. And they had all these trim, toned models.
Yeah, they've done all kinds of other exercise.
Exactly, you know. I'm guaranteed they're not there just doing, you know, standing on this vibrating platform.
Yeah.
But, you know, people will blindly buy into that.
Yeah.
But when it comes to things that are a speculation, all of a sudden science becomes super important. And, you know, oh, I don't believe in that because it doesn't look like it's doing anything. But here the person is with, you know, the TV Week infomercial gym equipment and the diet to back it up. Yeah. Yeah, this works. It really does.
Yeah. Yeah.
It's, you know, perhaps it's more of an education for not just osteopaths and people at, you know, doing manual practitioner, but like you said earlier, the communication and explaining what you're trying to do of this particular model that you've got.
Well, that's also where, you know, we have a professional role. You know, it's not just some association. It's a profession. You know, that's the difference between a profession there's a different level of standards.
Yeah.
And you know, we have to be able to, for one, stand up and to some extent try and describe what we're trying to achieve.
Yep.
Be open to criticism about why that may or may not be correct, and if we really think that it is something that has benefit, then we need to be able to stand up and go, well, we think that this is so because of that. And you know, it's funny because when you're in the room with a patient, you use all the knowledge you might have and all the evidence that you might have, but you have to apply it to that moment when you're dealing with another human being.
Yeah.
And that's where it gets that step further from just going off a protocol that was just research. You might use that, but you cannot just base your interactions with others. Nothing is textbook.
Yeah.
In order to apply a treatment. And as I was saying to you before, you know, when I eventually do get to my treatments, of late I find that a lot of my treatments are based on what I've diagnosed, and then the actual techniques I apply are a mix of what are classically a few different so-called treatment modalities in terms of, like BLT, manipulation, articulation, whatever, to try and get a change for that person depending on their specific whatever strain.
So you don't rely solely on a particular type of treatment. Like you won't rely, you won't treat someone completely with HVLA regardless of the complaint. You'll incorporate everything in yours.
Yeah, I try to.
Yeah.
And I suppose I'm better at doing certain types of approaches than others.
Yep.
In terms of other types of approaches, and other people might be much better at a particular kind of approach, and they'll get their changes in that way. And I do strongly believe it's not as important what you actually do in terms of, you could see the same person as me, and if you're very good with your articulation and your structural, very direct approaches, you might, be able to use those to get exactly the same results that I would use for that. I would use an indirect approach on that person. Yep. It's a bit like, if we could take it back to martial arts and stuff, you could have people who are experts in different weapons, but they might achieve the same result with a different approach. It's the same. It's a poor metaphor, but
no, it's understandable. What was I going to say? It's in terms of your treatment. I used to work in as a personal trainer in a gym, which is kind of where all this university journey began. And I've seen that the fitness industry, particularly personal training, and actually just gyms, everything's kind of transitioning to 24 hours. Yeah. There's a lot of cannibalism that seems to be in the fitness industry.
Cannibalism?
Yeah.
It's extreme.
It's very extreme. It was an analogy that my old boss used, Tony, and he was referring to, say if there's a town of 10,000 people, within that there'll be 6 or 7 gyms. Yeah. And one will open up after the other, and the new gym is no longer new, so a new one will reopen. And it's continually trying to just get the majority of customers. Yeah. Now, as you were saying before, each osteopathic practitioner might be well equipped in a particular style of treatment, like BLT, HVLA, or myofascial release. Yep. Can you speculate as to, do you think that there will be courses purely based for osteopaths to do myofascial or BLT?
Do you mean like undergraduate courses before you get out to do osteo? Yeah. Well, to some extent, that's already happening. Right. That's already happened. If you look at the courses in, for example, in New Zealand at Unitec, which is where I studied, they no longer teach any kind of cranial osteopathy approaches. Right. Now they were very structural anyway in their approach for a long time, but they've completely cut that out of the curriculum. Okay. And personally, I think my personal opinion is that is a mistake. Yep. Because that is just another very useful, unique model that we could use to help our patient, and it gives us a bit more of an edge. Yep. But so that is already to some extent happening, and some people would argue, well, then you're not teaching the entirety of osteopathy. But I would go a step back and go, well, actually, the treatment approach you use is not as important as why you do it. Yeah. And if you want to go all the way back to the beginnings of osteopathy, it was said that Still pretty much never taught any techniques.
I remember, I vividly remember reading that.
And the reason he did that, I think, is because he didn't want people to get stuck on the actual what you do as much as why you do it. Yeah. And
which comes down to intention once again.
Yeah. And that each person has their own different way of moving their own body, and then another person's body as well. Mm-hmm. And now we've got into a situation where the how we treat has schismed osteopathy in a way. Mm-hmm. You have people who are very structural in their approach versus people who are very functional or indirect in their approach, and that has kind of, to some extent, created a bit of a rift where they don't talk to each other, and the one says, "Well, I'm doing osteopathy," or "I'm,"
Yeah, yeah.
And that's just a very modern example. There are other examples, I'm sure, through history I'm unaware of, but
Yep.
And I think it's a shame because it's missing the point, really.
Of incorporating everything rather than just nitpicking. Well, not nitpicking, but
Yeah.
sort of, favoring things over others, which, on the other hand, can be really good because that one person will be really, really good at that certain thing. And that's where you'll go, well, I think the patient will get a better response with this type of treatment. So come to my friend or someone I know that's really good at this.
That's so it. And as you said before, the tradie who comes in who doesn't want anything to do with, although that being said, I've had, tradies who are into all kinds of different treatment.
Yeah. It was a very basic, poor analogy.
Yeah. So, for a person who comes in, an example, in New Zealand, we had I think he was a surgical resident come into the practice.
Yeah.
And he didn't see me, he saw my boss, and my boss came out afterwards and said, he was shaking his head. And he said, that guy went to see another practitioner.
Yeah.
And he'd come in for headaches. And the fact that he'd gone to see an osteopath was, we thought was great, because we want to we want to have dialogues with people like exactly that.
Yeah.
And he went to see this another practitioner who didn't really say very much and spent the whole treatment holding his feet.
Right.
Now, according to when he questioned him, he said, well, what I'm doing is I'm working through your fascia and getting that to unwind through your feet, and that's what's causing your headaches.
Yep.
Now, of course, this surgeon basically walked out going, well, I'm never going back there again. That guy's crazy.
And this guy's a surgeon, like he knows anatomy really well.
Yeah, for sure. He's been doing it for a long time. He's very experienced. And he went to see another osteopath, which was my boss. It could have been that he'd never gone to see an osteopath again because he just thought we were all crazy because of this experience. And he saw my boss, and my boss worked on that area directly. And so then you go, okay, well, it may very well be that guy was right and that, that he needed that approach.
Yeah.
But if you don't have the patient buying in, and if from what you know of them, you have to make some kind of judgment call of, well, for this person, I think that would be great, but you know what? I'm just going to approach it this way because that way they'll be happier with coming to see me, and then I will be able to help them. So it's actually it's unhelpful to them to approach it in that way because you're just going to drive them away. They you can't. Which
is essentially, you're playing into that placebo effect.
Exactly.
It only makes sense. And I suppose some could say that you're cheapening it, and you're not, you're not doing things the way that you want to truly do it yourself. But at the end of the day, you're not there to make yourself feel better. You're there to make the patient feel better.
That's right.
So,
that's absolutely right.
The patient is the primary response. Yep. I know for myself, I've seen only student osteopaths here at the clinic.
Yep.
But I've also been treated by a few physios and things over the times. And regardless of who you go to, there's always going to be those individuals that you just don't gel with. It's that.
That's right.
Just connecting with someone. Like if someone's the best chiro or whatever in the world, you meet them, they introduce themselves, and you just get that vibe. Not everyone's meant to like everyone. That's why that's why we're not everyone's happy together.
That's right.
The individual itself.
Yep.
You could be the best, but the treatment you give might not work. That doesn't reflect your treatment. No. It just goes, well, you know what?
Yeah.
We're here.
Well, I think that brings up a really good point about treatment is that, the outcome of a treatment is, it's not just the treatment, it's the sum of the practitioner and the patient and the treatment together that brings about the outcome. Yeah. And it's a really good point you make that if that's not there, if it's not going to equal a good outcome, then that's just not going to happen.
Exactly. Could be the best treatment, but hey, that guy was an idiot, or that girl was, she smelt funny. There's all these different personalities, and not everyone's going to mesh.
Nah, definitely not.
So, So, we're an hour into this now.
Yep.
I've had a lot of fun.
It's been great.
It's
gone really quickly, hasn't it?
it goes real quick, yeah.
Yeah.
Just to finish it off, if someone was to come see you,
Yeah.
Tell us, your what you just give us a bit of an insight into how you found osteopathy, how you like to treat, your approach. Are you gentle? Are you direct, indirect? Just to, talk yourself up a bit, I guess.
It's not something I traditionally like to do.
Yeah.
Well, I think if someone comes to see me, my whole intention is to get them where they want to be.
Yep.
And I will work as best as I can to do that.
Yep.
And I will try and get there using any means that I think appropriate,
Mm-hmm.
and that patient could respond to.
Yep.
So that means that I might see two people in a row for exactly the same problem, but
Mm-hmm.
based on why it's there in themselves, I
Yep.
might treat the one entirely using massage techniques and articulatory techniques.
Yeah.
And the next person I may entirely use indirect
Yep.
approaches in order to try and get a change for them.
Mm-hmm.
But the other thing I'll say is that, in the best, I mean this in the best possible way, which I say to my patients as well, I'm trying to get rid of them.
Yeah. Yeah, there's
You know?
there's a bizarre dimension of, do you want them coming back constantly?
Yeah.
It's going to be good for business if you're that way inclined, but it's kind of reflecting that your treatments aren't working properly.
Yeah.
So...
I really want to work things out. I
Yep.
really want to figure out why it is that this person has this issue that they've come to see me for.
Yep.
And then I want to get to the bottom of that, and I want to make a fundamental change in that.
Mm-hmm.
And then I want them to be able to stand on their own 2 feet.
Yeah.
I want to make myself redundant. And that's one of the funny things about being in healthcare is that you're trying to make yourself redundant a lot of the time.
Yeah.
Which in terms of business, it's a very bad business model,
Yeah. Don't come see me. Stay away.
That's right. Yeah.
Yeah.
But actually, I think it's a way more fulfilling business model.
Yeah.
And also what you do is you create space for people who really need your help as well.
Yeah.
And people, they really appreciate the fact that you're not doing it because you want them to keep paying you money.
Yeah.
And this is interesting where it comes into models of treatment, of wellness treatment.
Mm-hmm.
So, people who go, well, you should come see me once a month because I need to maintain your body for you.
Yeah.
Now
in
that's
essence, dumbing the person down and making them feel incapable of healing themselves, which is what we don't want.
That's exactly right. And I prefer to err on the side of what I want to do as little as possible that in terms of taking care of your body, because your body has the capability of doing it yourself.
Yep.
I'd much rather that, we deal with this neck strain that you had from a car accident, or, this punch that you took to the head.
Yep.
And then you go and do yoga or Pilates or whatever kind of exercise you enjoy, because if you do that once or twice a week, you'll get so much from that.
Yeah.
Not just in terms of health, but also in all kinds of different ways.
Exactly.
Than coming to see me every week. But, if they choose they want to come and see me, then that's their choice too.
Up to the patient, yeah.
Yeah, so that's where the communication comes in. You can say, well, we can do it this way and we'll see you every few weeks.
Yeah.
Or, we can do this and then you can do that for yourself and you'll be on your own.
Give
and then
them
become,
empower themselves, know. And
totally about empowering the patient.
Yeah.
And look, I'd say that's my ideal and that's what I aim for. And,
Yep.
I probably don't get there every time.
No one's perfect.
Nah, well, that's what you aim for. You try to
Exactly.
improve on it every time. So, yeah, in terms of treatment itself, depends on what you're in for. But I would say that I always communicate with my patients. I'd never do anything that they hadn't agreed with as well.
Yep.
Yeah.
Fascinating, mate. This has been awesome. I hope anyone that's out there listening feels the same. And I'd love to have you on another time.
Be fantastic to be back. Be great to maybe get a few other professionals in here as well in terms of physio or chiro, and have a bit of a conversation about
that's
stuff.
That's the ultimate goal, and I'm glad
doctor, surgeon, whatever.
I'm glad you brought that up, because the intention isn't only to talk about osteopathy, but I want to get we Darby, Jelly, and myself, we're all in the same boat as we want to get a lot of different other type of people helping practitioners in.
Well, as a side note, I think in terms of healthcare, that's where healthcare is heading.
Yeah.
We're heading towards interprofessional practice.
Super clinics.
Super clinics, that's
Exactly,
right, yeah. And we need to start dialoguing with one another about what each one of us does and how we can work together. And because ultimately what we're trying to do is help. I mean, this is where the big stuff comes in. We're trying to help humanity.
Exactly. making the individual feel better, which then reverberates out, and
that's right.
Break down those misconceptions that there might be between a surgeon and a doctor and a chiro and a physio. We're not children here. We're here to help the patient. Let's not make this inherent rivalry that seems to be among us be at the detriment of the patients coming in, because they're the importance here.
That's absolutely right. Yeah.
So hopefully this podcast deals with that. Become something substantial. If not, it's a hell of a ride. It's really fun. So
thanks for having me on. It's been great.
Thank you very much, Andre. This is podcast number 3. Next week I'll be in Melbourne. I'm not sure where the other 2 guys are, but we've got other guests lined up. Karen Jung, talk about diagnosis for reasons that we will uncover during the podcast. And thank you for whoever is listening. Thank you for whoever likes us. Thank you for your support, and thank you for your criticism. When you listen to this, tell us what we could improve. We're all here to get better and
definitely
help everyone out. So that's been podcast number 3. This has been Reese with Semantics, and thank you very much. Enjoy your day, guys.